Hello, everyone. So my name is Kathy. I also go by Miss RN Diva, and most recently I switched over, dropped the Miss RN Diva, and put the Holistic RN Diva. So I'm the Holistic RN Diva. I'm all about holistic health, teaching people the natural ways to heal from the root, from the inside out, to get us back to feeling whole and well again. That is what my book is about. The book is just a beginner's guide, just to help people start with dealing with the emotions, their environment, the little things that can cause bigger things to happen later on if we don't address them now early in life. So that's what the book is about. But I came on to just do this video real quick because I was having a really good conversation with one of my family members, and we was talking about kidney failure. My father had kidney failure, and I was 18 years old when I found out about his kidneys failing. And one of the things that contributed to his kidney failure was the fact that the diabetes was uncontrolled, high blood pressure was uncontrolled, and on top of those two things being uncontrolled, he was on multiple medications for the diabetes and the high blood pressure. Many of them were trial medications. That's why I'm really big on the trial medications. Like, I wish I knew more at that time. I was only 18. I wasn't a nurse yet. But my father was put on a lot of trial medications, and by the time we discovered he was at end stage, it was pretty late. There was no reversal. So I've always been on a mission since being a nurse. Look at it's at my father passed away in 2004, and one of the things that I dived into was my work, and really trying to find ways to take better care of myself and also take good care of other people. Because I kind of started to look at people like my dad. It's like I don't want them to go down this path if we can prevent it from going that far to the point of your kidneys are failing, now you need dialysis or a transplant in order for you to extend your life. Like, how can we stop the progression of getting to the point where your kidneys are no longer working and you have to now rely on dialysis or a kidney transplant to sustain your life, and because going on dialysis, a lot of people may suffer from depression. It's really hard to adjust your lifestyle. Like, you are now having to go to a clinic 3 days a week, and it's so draining. Even though you're sitting down, the exchange of blood in itself is so draining on the body. Most people who are going through it, they become depressed. I know my father was depressed, especially because he wasn't able to fly out the country, because leaving the country, it costs a lot more money to have dialysis done in the Caribbean island. And at that time, it was not many locations that will offer dialysis that was affordable if they did offer it. So that was a challenge. So, and also the restrictions and what you can do from what you can't do. You can't eat this, you can't eat that. So it was really a hard adjustment, and I went through that journey with my dad. He unfortunately did pass away. And I have always been on a mission to, teach people. When I was working with my patients who are diabetic, who have high blood pressure, it was important for me to help them understand how to effectively take care of themselves, not just taking medications, because one of the things that don't speak enough about, and I know the reason why, but I'm not going to go through it here, is that some of these medications can contribute to the kidneys not working efficiently, especially if you're on a diuretic. That's why it's so important to follow up with your doctor, to make sure they do your blood work, to make sure your creatinine levels are within normal range, and because the diuretic can dry out your kidneys. If you're, if it can dry out the kidneys because it's too much. So they need to adjust the medications so that the creatinine levels are within that normal range. So there's other things, just like, the medication have to leave the body, whether it's the kidneys are the one filtering the medications out the body, or it could be the liver. Either way, if it's the kidneys and you already have kidney failure, you're causing the kidneys to work harder, which then contribute to the kidneys being less and less effective in how it's working. So it's so important to understand the medications that you're taking. We also want to understand how to truly manage your blood pressure. Now, if you're taking blood pressure medication, that's good, but let's talk more. Let's go a little bit deeper. What is causing your blood pressure to be high? Is it you're overweight? If you're overweight, you want to work on weight management, exercising. Exercising is a very effective and doesn't require no medication. It's a way to help lower your blood pressure. Also, exercise is also a good way to help lower your blood sugars because you are increase your metabolism, and in that, you are able to help burn that sugar, lower those sugar levels, and that also helps with your heart, and it also helps reduce your blood pressure. Now, meaningful physical activity, not the one that we do at work when we're under stress and we're under pressure and we have to meet these deadlines. That trying to meet deadlines and you are under pressure, that is not healthy exercise and healthy activity. That's actually stress, and that can cause your blood pressure and your blood sugar to go up, right? So once again, so it's not just medications, it's not just adjusting your diet, because diet is very important, but it's also looking at that bigger picture, your whole life, that lifestyle, your everyday in and outs, everything that you're doing. All of that can contribute to your blood pressure being elevated, so your sugar is being elevated. So even though you're taking medication, you may wonder, like, why is my sugar still high? Why is my blood pressure still high? Why am I not getting better? Because it's not, the medication is just like a Band-Aid. And when we look at diet, oftentimes they would say, oh, go on a 2-gram sodium diet, or cut out the rice, cut out the bread. But it's more than that, because you do need carbs, but you want the healthy carbs. So one of the things I teach my patients and clients is, okay, let's look at what we're eating. How can we modify, do a little tweaking here, do a little tweaking there, so that what you're choosing to eat is in alignment to your preferred food choices, right? Because I feel like it's hard to commit to something that you are not accustomed to. And some people can adjust. Their palate may adjust to this new food, but probably will not. And so that means you are temporarily going to follow this diet, but it's not going to be long term because your body doesn't want it. So it's always important to look at what we're eating and when we're making these adjustments, we are making adjustments that we can commit to, ones that we like. And we also want to look at portion. The problem with diabetes is that we are living in a state of excess. Sometimes I overeat. So let's cut back, use a smaller plate opposed to a large plate. And what I like to do, I substitute my rice with quinoa. I love a yam. Sometimes I will bake a yam. I will probably bake a white potato. If you do have kidney failure, you cannot have the potato. Well, you could have the potato, but it's a really long process. You have to peel it, soak it, rinse it out, soak it, boil it. It's a long process. So, but we'll talk about that in another video. but I'm talking from a point where we are not at that stage of kidney failure. Okay, let's start from there, because it's so complicated. When you get to the point that you have kidney failure, there's so much food that you can't eat, that I like to start from the point of what you could eat. That's a little bit more easier. But so when you're diabetic, or if you have high blood pressure, I'm going to say the simplest way that I can say it so that it's understood is eat what God creates. It is the most simplest way I can put it. Eat what God creates. Eat less of what man manipulates. Because when people start manipulating the food, adding and subtracting and putting something back in, that is when we get to a point where the food is not that good for your body. So we want to be more uh, on the side of the natural foods that we are preparing at home. I know at times I myself may go out and order food. And the healthy choices is so expensive. Like Panera Bread will have some good choices. If you include the meat, it may have a little bit more sodium. And if you have high blood pressure, you want to be careful of the meats because they're definitely going to have some sodium there to keep the taste um, and to preserve it. So, but Panera Bread is a good choice. Chipotle is a good choice. You just may not want all the toppings on it. You could just, and probably not do the rice. You could do the beans because beans is a good source of protein. Or you can do the brown rice or the white rice. So there's ways that we can pick and choose how we make the meal healthy, especially if you're on the go. But the best way to feed the body is by feeding your body what God creates and what you prepare at home. That is the most best way to eat. And also you want to do less of the canned goods. Frozen foods are okay, but you want to, not do too much of the frozen foods that have a sauce. Or some type of sauce, like, you have like creamy broccoli, things like that. It tends to have more sodium in it. So these are just some healthy ways to like really adjust your lifestyle so that you can start really fixing the root of what's causing the problem so we can avoid going down the path of developing kidney failure. Another thing we like to do is like stress reduction. Stress is actually one of the primary causes of many of these problems that we are dealing with. Heart problems, diabetes, autoimmune disorder, stress. And the thing about it is, can we really truly escape stress? Probably not. Because work can be stressful. Home, if you have kids, that's stressful. If you're in a relationship, you go back and forth, it's stressful. It's how we cope and deal with the stress in our life, right? And also making sure that we are carving out time for self-care, doing certain little practices that will help you just breathe in and breathe out anything that may be causing you to feel upset, angry, frustrated. Like, you want to do stress reduction activities. So deep breathing is a really good way to like just woosah, like woos it all the way, like breathe out. Like, that's an effective way of helping reducing stress. Going out for walks, especially if the day is sunny. You're going to get some vitamin D. Vitamin D is great for not only your immune system, but it helps with your mood. It helps with depression. So that's really good. And as you're walking, you're actually lowering those cortisol levels that tend to increase from the stress. And when your cortisol levels are up, that can also predispose a person to diabetes, high blood pressure, and other autoimmune and inflammatory conditions. So walking, that's that activity of walking, deep breathing, getting some exposure to sun, looking at the trees, just listening to the birds. All of those things are cheap, healthy, and very effective way to manage stress. Physical activity. We talked about the walk and talking about exercise. I always tell people, do what makes your body happy. I love to dance. I fell in love with Pilates. So Pilates is expensive, so I bought my equipment so I can do my Pilates from home. I could turn my camera that way. You can see it. I have a little corner with all of my Pilates stuff. Okay, so, and right now I'm actually on my stepper that I'm stepping on so that I can also exercise as I work. So this little movement, any type of movement, at least 30 minutes a day is really good to start out with, and then you can increase that time if you can. And I know with work schedule, it's sometimes hard, but it's just as long as we do at least 30 minutes every day and then watch what we're eating. And like I said, cut the portion size. We can effectively help restore our health, lower that blood pressure, lower the blood sugar, and also lower the risk of having kidney failure, which is a secondary complication related to uncontrolled diabetes and high blood pressure. Not only that, when your blood pressure and your blood sugars are not controlled, it can increase the risk of heart attack and stroke and other illnesses. So this is my little brief little education. I was going to do it over the weekend, but I was like, no, let me do it today. It was a really good conversation I had with my cousin, and I was like, I've been waiting to do this video, and I was like, well, let's do it. I just got a meeting, and I just felt like the spirit was saying, get on and do this video and just post it. So I hope that this information is helpful. Please subscribe. I'm going to try to do more videos. I am new to this. I'm trying to build my channel. I do have a book available on Amazon and Ingram Sparks. It's called Whole and Well. It's by Kathy Proctor. You can Google it and look it up. I wish I had it near me, but I don't. But that is like a beginner's guide just with tips. It have like a workbook in the back where you can like track what supplements you're taking, track your doctor's names and their numbers, medication that you're taking, some mindfulness activities is also included in the book, and I'm sure it will help someone. So I will make sure to do more videos. Thank you for watching. I hope you watch it till the end. Please subscribe and share, leave comments below. And you can always reach out to me if you want a one-to-one consultation. I do a health appraisal, which is a long assessment, but it really kind of helps to see what area, what system that we need to focus on so we can get you back on track to feeling whole and well. So thank you. Oh, I forgot to say, so my email address is kproctor, so that's KPROCTOR at wholesometouch.net. And you can always go to my website and you can schedule a free discovery call. And my website, it is www.wholesometouch.net. And thank you for watching. Have a wonderful evening and you take care. Bye.